Hi everyone, this is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital. So, as a gynecologist, when I go into the society or a function or in our close group or a colleague circle, the common question generally we ask is what is the appropriate time for planning for pregnancy? What is the ideal age to plan the pregnancy? So ये क्वेश्चन का आंसर देना इस बहुत डिफिकल्ट है, पर साइंस के द्वारा जो अभी तक की रिसर्च हुई है, जो अभी तक के गाइडलाइंस है, उसमें वन थिंग इज वेरी कॉमन, द आइडियल एज शुड ऑलवेज बी लेस देन 35 ईयर्स, बिकॉज वंस यू क्रॉस द 35, पर्टिकुलरली ऑफ अ फीमेल्स एज, मेल में उतना इम्पैक्ट नहीं आता है. Female age, which is very important, when you cross 35, few of the problems inherent are nature. So कौन से problem generally female face करते हैं if female's age has been crossed to more than 35 years, is one of the most common problem that they are facing is the fertility issues. Of course the pregnancy रहने में दिक्कत आ सकती है, problems related to the bleeding and uterus is common. Few of the patients may develop fibroid or endometriosis. Apart from that, main reason which is responsible for fertility issue, if age is more than 35, is the ovarian reserve and the quality of the eggs, because they generally starts declining. So if the female's age is less than 35 years and they come to us for a preconceptional counseling, we generally say go home, try for a year at a instructed manner, proper way, and then if you don't conceive, come back to us for the further management. But when the age is more than 35, this duration has been narrowed down, and we generally give them and say that try for a 6 month. If you are not able to conceive, come back to us if everything else is normal, because hurrier is always the better one. The second most important problem we generally face if the age is more than 35 is the probability of having a birth defects or mainly chromosomal problems and aneuploidies, that is a Down syndrome, because age more than 35 is an independent risk factor for Down syndrome, and proper screening and diagnosis of Down syndrome, that is a trisomy 21, that is a 21st number of chromosomal abnormality, aneuploidy, has to be there if couple conceives and the age of the female is more than 35 years. Generally it is a routine protocol for at a majority of the obstetrics center, but still you have to look for it. The third most common problem we are facing is maternal health issues, particularly pre-existing diabetes, hypertension, other cardiac issues. Female or a mother may prone for development of gestational diabetes and preeclampsia during the pregnancy. And the last issue which we can see in OPD due to age is recurrent miscarriages or abortion, and the probability of multiple pregnancy or a twinning may high or can be high in a couples where the mother's age is more than 35 years. It's not always so, still the twinning is very less common, but yes, more than 35 to a certain extent it can increase the chances of twins pregnancy compared to mother who are having an age less than 35. वो one to one correlate नहीं होती है, but few of the literature suggests that possibility can be there. But other than twinning, more important issue we are facing nowadays is multiple abortions and miscarriages, that is recurrent pregnancy loss or bad obstetric history. बट इन अ नटशेल आफ्टर दिस डिस्कशन ऐसा दिमाग में नहीं रखना है कि मोर देन 35 यू कांट बी प्रेग्नेंट. देयर आर एक्सेलेंट आउटकम्स वी आर सीइंग इन ओपीडी वेयर द एज इज मोर देन 35 years. People are saying that nowadays the 40 years is a new 30 or a modern 30 or a next generation 30 because of our lifestyle and everything. We are catering the patient who are always or a majority of the cases are in this age bracket, and we are getting a very good outcome as far as the pregnancy is concerned. So दिमाग में ये बात बिल्कुल मत रखना कि आपका एज अगर 35 से ज्यादा है तो आपको प्रॉब्लम फेस करनी ही है. Probability can be there, but with a good obstetric care, the outcome can be excellent. पर इतना ध्यान रखना है कि you can't ignore everything. You have to be, follow the proper instruction. You have to go to a necessary investigations and required treatment so that your overall pregnancy experience can be improved. If you have IVF pregnancy also or a pregnancy after the infertility treatment, still age does matter, but ऐसा कोई fixed criteria नहीं है. These are all the literatures which are suggesting take your own time. Whenever you are ready, plan for pregnancy, but plan it early. Don't wait unnecessarily. We always say when you are psychologically, mentally and financially ready to have a kid, take your own decision. If you have any query regarding this, you can consult your healthcare provider or contact us anytime soon. This is Dr. Priyadat Patel, your go-to gynecologist from Balaji Horizon Women's Hospital. We wish you a very healthy pregnancy. Thank you so much.